Great. Hi, everyone. Well, we're recording this intensive in early January of 2023, so Happy New Year. I'm Annette Altmans, founder and CEO of the MEND Project. Before we get started, I just wanted to mention that our free monthly training intensives feature topics that our followers either request or have generated a lot of interest via emails and other comments that we received through social media and so forth. And during these intensives, we take a deeper dive into various issues related to emotional abuse or double abuse. And if you have a topic that you would like for us to discuss, please send your ideas or your concerns or matters where you would like more clarification to info@themendproject.com. We love receiving your thoughts and concerns. All of our intensives are recorded and housed on our YouTube channel and our training and resource page at themendproject.com. So you can catch any previous intensives at either of those places. At the end of the presentation, I'll address your comments and questions from the chat. So it's really helpful if you share your thoughts and questions in the chat as soon as you think of them. Don't wait till the end because it helps Jill get those organized. And if you'd like to send them anonymously, you can do so by selecting Jill Rice from the drop-down menu, and she'll make sure that I address them during our Q&A discussion time. All comments and questions will be shared in a manner that maintains anonymity, so you don't have to be concerned about that. If you are viewing this on YouTube as a recording, please be sure to subscribe and post your questions or thoughts in the comments on YouTube. Today, I'll be talking about a topic that's really near and dear to my heart, trauma. I'll specifically be focusing on a few specific ways trauma affects children. And I want to note up front that the information I'm going to be sharing today comes from many sources, including Bessel, Kolk, and the Trauma Stress Institute, the American Psychological Association, and Psychology Today. In our comprehensive MEND curriculum, we dedicate an entire chapter to trauma. It's actually the reason why we do the work that we do at the MEND Project, because of the harmful effects that abuse has, the trauma that it causes, and the ways that trauma impacts victims emotionally and physiologically. There's so much to say about trauma. There's post-traumatic stress disorder, complex post-traumatic stress. And if you missed our intensive in June of last year, you can learn more about those two by watching that one on our YouTube channel. I'd like to start by defining post-traumatic stress disorder, which is a classification made for adults who experience a terrifying event or ongoing abuse and neglect. It can include unwanted, intense, and even disturbing thoughts and feelings related to their experiences that last months and sometimes years after the traumatic event has ended. PTSD may look like flashbacks, a sense of terror, anticipatory fear, or a flash forward. It can display in the fight, flight, freeze, and appease ways, which would be, anger is in the fight mode, or freezing or numbing out, and hypervigilance, they're overly alert, or they're in an elevated state of constantly assessing potential threats. And each of these symptoms can result in unwarranted conflicts or isolation. When an individual experiences multiple chronic, interpersonal, or invasive prolonged traumas, and where the victim is overcome with a sense of hopelessness and despair, PTSD can easily transition into complex PTSD, a much more serious form of trauma to heal from. It's particularly harmful because of prolonged and repetitive exposure to traumatic events, where the victim loses their sense of identity, where they reach that state of hopelessness and despair. Complex post-traumatic stress disorder has a significant effect on the person's emotional regulation and their identity. So CPTSD also sets in motion a biochemical immunological chain of events that often results in an unusual number of medical problems in addition to the emotional effects. Victims may also be so overwhelmed with emotional dysregulation and medical illnesses that they have a hard time understanding what the source of their problems are coming from. Fragmented thinking and communication frequently accompany trauma, and the more fragmented their thinking becomes, the more difficult it is for someone to discern what's actually happening to them, or to remember certain traumatic events, even if they just occurred like within the last 5 minutes. It's hard. Fragmented thinking is really, can be really crippling at times. Their cognition becomes impaired and their confusion escalates their symptoms. A growing number of studies and research in the area of complex PTSD and how it relates to children has led many expert psychologists to define complex trauma in children as very different and more crippling because trauma impacts the brain, which causes many more long-term symptoms during a brain's developmental stages in life. At this time, the DSM-5, the DSM is a diagnostical and statistical manual that therapists and the medical profession use. And this most recent publication includes a diagnosis for adult onset trauma that is often applied to children, PTSD, but the DSM still has not included or recognized the diagnosis of complex PTSD, even though it's becoming more widely recognized by medical and psychological professionals. Now, the internationally recognized equivalent to the DSM-5 is called the ICD-11, put out by the World Health Organization, and they have recognized complex PTSD since 2018. And so the reason I'm mentioning this is if you take your child to therapy, the therapist may not know about complex post-traumatic stress, and there's so much information that can be helpful for them by doing some of their own research. And for you to choose somebody who's aware so that they're actually going to be serving you and your child in the best way. Children do not meet the diagnostic criteria as it does not capture the developmental effects of childhood trauma on the brain and so forth. However, there is no other accurate diagnosis to describe the pervasive effects of trauma on a child and the child's development. A task force of clinicians and psychiatrists and other medical professionals have conceptualized a new diagnosis that they're proposing for the DSM called developmental trauma disorder, which more accurately describes what happens to the developmentally aged child. Bessel van der Kolk is one of the experts leading the way, and I'm fond of his work on the topic. According to van der Kolk, this provisional diagnosis, this is quote, the provisional diagnosis is based on the concept that multiple exposures to interpersonal trauma, such as abandonment, betrayal, physical or sexual assaults, or witnessing domestic violence, have consistent and predictable consequences that affect many areas of functioning. These experiences engender intense effects such as rage, betrayal, fear, resignation, defeat, and shame, and efforts to ward off the recurrence of those emotions, including the avoidance of experiences that precipitate them or engaging in behaviors that convey a subjective sense of control in the face of potential threats. Their physiological dysregulation may lead to multiple somatic problems, so illnesses such as headaches and stomach aches in response to fearful and helpless emotions, end of quote. So that was a mouthful, but I think it's really important to read. So moving on, the reality is most trauma begins at home. The majority of people responsible for child maltreatment are the children's own parents. And that's what 80% of the time research indicates. Traumatic childhood experiences are extremely common and have a big impact on multiple areas of functioning. The Adverse Childhood Experience study, ACEs, which you may know it by, it was put out by Kaiser Permanente and the Center for Disease Control, showed adverse childhood experiences are even more common than recognized and acknowledged, and they have a significant relationship with future outcomes, such as depression, suicide attempts, alcoholism, cigarette smoking, drug abuse, sexual promiscuity, domestic violence, etc. And further ACEs information revealed that the more adverse childhood experiences or trauma, the more likely they were to develop disease and illness, serious disease and illness, such as heart disease, stroke, diabetes, cancer, and liver disease. The effects of developmental trauma can be devastating and can be manifested in a variety of ways. In children, it can be seen as sensory processing disorder, oppositional defiant disorder, bipolar personality disorder, depression, phobic disorders, separation anxiety disorder, mental illness, ADHD, PTSD, speech delay, learning disability, cognitive impairment, and so on. You get the idea. It causes a multitude of problems, which can make it even more complicated to diagnose and to really focus in on the ways that maybe your child is manifesting this trauma. Developmental trauma as a disorder, or DDT as they call it, encompasses 15 possible symptoms, such as habitual self-harm, extreme distrust, or verbal and physical aggression towards others, and many more. According to clinical psychologist Julian Ford, the director of the Center for Treatment of Developmental Trauma Disorders at the University of Connecticut, development trauma disorder is a disorder where kids are fundamentally feeling insecure and that there is something wrong with them because they are either in emotional turmoil or emotionally shut down. He also notes that this emotional dysregulation occurs because they have essentially organized their development around survival. So that goes back to that fight, flight, freeze, appease display of trauma. So kids have organized their life around that survival instinct. Ford is the co-principal investigator of the developmental trauma disorder field studies with trauma psychiatrist Bessel. So he's someone that is highly recognized in this diagnosis. Chronic trauma in childhood impacts brain development. Let me just touch on that for a second. So where the amygdala would be the accelerator in a car that, alerts you to danger, it gets overdeveloped. And the hippocampus, which acts as the brake in a car to help regulate you, becomes underdeveloped. And so these are tangible developmental problems that occur in children who have experienced trauma. I'm sorry for my dog barking. Also, early attachment styles with primary caregivers affect information processing for life. And we're not really going to go too much into attachment, but if you don't know about attachment styles, I really encourage you to Google that because it's an essential way for a child to connect with their caregiver. And if that is disrupted, it creates a number, it's also trauma and it creates a number of problems. And you may inadvertently be doing some of those things that deletes the kind of secure attachment that you would hope to have with your child. So, for example, a securely attached infant learns to trust that their needs will be met, and they will trust both their feelings and how they experience the world. These early secure attachments shape them to trust their emotions and thoughts about any situation. So secure children have a robust vocabulary to describe what they're feeling. So in other words, they have a higher emotional IQ, which allows them to communicate it and find a strategy to resolve it. Security provided by means of predictability and continuity is critical for a child's development. They are actually learning to master their own experiences. Children depend on their caregivers for survival. They do not have the option to move away and protect themselves. So, adults, we can make a lot of choices, but children are controlled by adults. So it's an entirely different dynamic. Therefore, trauma stemming from within the family creates a crisis experience for the child where they no longer have security and loyalty, and they flip into survival mode. For adults, a survival mode would look like fight, flight, freeze, or appeasing the person responsible for causing the trauma. But with children, they cannot flee from their caregivers. They often cannot fight them, although they may attempt to. Therefore, they often are limited to freezing or appeasing the perpetrator. And because these children are in a constant state of anticipatory fear or conflict, their involuntary responses cause them to dissociate or become disconnected from their own emotions. So they're so out of touch with their feelings that these innocent children lack the language to describe what is happening on the inside. And dealing with it alone by complying or defying is how they adapt. And traumatized children who are left to their own devices results in significant deficits in emotional self-regulation. So remember I said the amygdala is overdeveloped and the hippocampus is underdeveloped. So this really impacts their ability to self-regulate. And I also want to go back and say, I mentioned that how an adult can leave a situation. They have more options, where children, they know they are controlled by their adults. And so you can only imagine that a traumatic situation they also have the added layer of oppression. And oppression, when adults feel oppressed, it's a triggering experience. It's traumatizing. So you can imagine how overwhelming this is for children. At the core of traumatic stress is an inability to regulate internal emotional states, leaving children with a lack of understanding of what is happening inside them, and therefore without a plan of action to resolve what they are experiencing. Insecurely attached children have a hard time relying on others for help and are unable to regulate their emotional stress by themselves. When they cannot achieve a sense of safety, control, and stability, the result is a feeling of helplessness, hopelessness, and despair. And helplessness will lead them to behave in a manner they behaved when they were traumatized all over again. So it may come out in just really in ways that almost looks like mental illness, because they don't have the surroundings to cope with it in a safe way. And so they're left to their involuntary reactions. And so sadly, these children are very misunderstood. They often receive negative labels that are very difficult to come out of or come out from under, such as rebellious, oppositional, or even unmotivated and antisocial. When in reality, traumatized children need a safe person to see them, to see their suffering, to help them understand their feelings, to help them put words to what they're processing. They're suffering alone with things like flashbacks, nightmares, school problems, and even things like amnesia, disorientation, and dissociation. Some who act aggressively also feel significant shame because they cannot regulate themselves to prevent acting out. And they don't like that they act out, but it's a coping mechanism that may work for them in the moment. And so they display these behaviors, but they also experience a lot of internal shame. And children who grow up in families where there is unmanageable stress won't be able to make sense of their experiences without the help of a caregiver who is trustworthy, reliable, and helps them. Their experience with complex trauma shapes their view of the world, which includes the betrayal and harm that they have endured. So it's very disorienting. They don't have normal role models and modeling and coping mechanisms. And so they misinterpret what's happening around them, and they anticipate it will happen again. They aren't exposed to healthier forms of communication, and so they don't develop those themselves while they're in this heightened state of fight, flight, or freeze. Their expectation that the trauma will keep coming back negatively impacts their relationships. So how do traumatized children heal? We're going to talk about a few different aspects of this. So treatment. Bessel van der Kolk's approach to healing for developmental trauma includes, number one, establishing a sense of safety and competence by helping them engage in activities that give them pleasure and mastery while facilitating self-regulation, including learning different reactions to issues than the reactions that they're typically used to. So let me just unpack that a little bit. Engaging them in activities that produce pleasure will give them positive reinforcement. It will give them a sense of accomplishment and autonomy as they are mastering various new skills. And this is really a positive way to counteract what is going on internally. It's not the only modality, but it is one of the modalities that has been found to be very effective. Number two is dealing with traumatic reenactment by replaying it with other people. So being able to talk through what they've been through in the past with a healthy caregiver or a therapist who can really encourage them to feel anger about that and really define what healthy emotions would be about a given situation. So they don't feel so insecure about the emotions that they're feeling, to really help them land on solid footing with describing the emotions that are appropriate for that, and really validating their experience so that they don't feel that they deserved it in any way, just really putting it into context that it was very unhealthy. And then number three is integration and mastery by engaging survivors in tasks where they can know what it feels like to be relaxed and to feel a sense of accomplishment, so that they actually, it's almost like art therapy, where you're in a different environment that has nothing to do with the trauma, and you're able to have this calm place where you can succeed in your art therapy or in a walk. We'll get into some of that, but basically that's being able to feel relaxed and have a sense of accomplishment is what he's addressing. A trained therapist will be able to bridge gaps in development in the specific area of the brain that has been impacted by trauma. Along with the excellent work of Bessel van der Kolk, Dr. Bruce Perry, a pioneer psychiatrist in the area of child abuse and neglect, has written on the important topic with contributions towards helping children heal, saying that traumatized children, quote, need patterned, repetitive experiences appropriate to their developmental needs that reflect the age at which they missed important stimuli or had been traumatized, not their current chronological age. And so they may need to go back and do, occupational therapy to bring them current, or they may need to go back and do some tutoring on some earlier concepts in the areas of academics that they're struggling, or they may need to go back and learn about emotions and the language applied to emotions that you would have thought would have been conveyed and taught at an earlier age. You need to meet them where they are. And often parents are traumatized themselves, right? Coming out of some of the same situations, either in their early childhood or in a situation like domestic violence. And they're not able to serve their traumatized child or children in the best ways without putting in significant effort to doing so. Because trauma is an overwhelming experience for both the children and the parent or the parents. And it's common that the parent or parents will not know what to do to help their child. And we have reviewed the ways that professional help traumatized children, that let me say this again, that professionals help traumatized children to heal. And I would like to instill hope and practical tools that can be utilized by parents or guardians to help the child who needs healing from trauma. And these are just a handful of things that a parent or guardian can provide. So number one is to remember that a child who has been traumatized may not have control of their behavior because the trauma they experienced left them feeling out of control and responding in involuntary ways. That's what trauma does. It produces involuntary reactions. Number two, be patient. Traumatized children need time to heal and feel safe again. They need new experiences to create new neural pathways, to create new thoughts, and to develop a sense of confidence in their ability to judge situations accurately. Because remember, they're insecure, they doubt their perspective because their emotions, they have a hard time articulating what they're experiencing inside. So their sense of safety and security has been destroyed, and now that regression is common and normal. But we want to help overcome that, and they can get there. Number three is spend meaningful time together. Turn your phone off and turn off the TV. Make a conscious effort to focus solely on what your child wants to do and on what they want to talk about or on what they are saying from their perspective in a conversation. You may not be able to accommodate them, but I want to just talk about an example. Let's say, for example, your child wants to go to Disneyland. I mean, what child doesn't want to go to Disneyland? It's important before you blurt out a short-sighted answer of, no, we can't afford it, that you validate them first and say, I know you would love to go to Disneyland and I would love to be able to take you there. I'm sorry, but I don't have the money to pay for it right now. How about we start putting spare change into a jar, and maybe by the end of the year, we can take a trip there or somewhere else that we can better afford. So the important point I'm trying to make is to avoid minimizing your child or dismissing or shaming them for choosing an expensive outing. When you take a moment to validate your child where they are, they will feel seen and heard, which will go a long way in not only reducing the impact of a no answer, but also helping your child feel that their hopes and dreams are important to you. And those are really important messages to convey to them. So validating your child's feelings help them develop a higher level of emotional IQ. When we shut them down and are abrupt, they may internalize your responses, I'm stupid or I'm unimportant. And children need adults to help them gain a strong sense of personal identity. Doing so helps the child trust their own perspectives. Let me give another example. I wasn't going to talk about this, but during the holidays, if your child comes to you and says, Mom or Dad, I don't like aunt or uncle so-and-so. And if you just quickly dismiss that and say, oh, just go give that person a hug and you can sit at the other side of the dinner table when they come over. Instead of just brushing it aside like that, it's really important to sit down and say something like, okay, let me hear more about this. Why don't you like this person? What's going on there? And don't judge their feelings. validate their feelings, so that a child cannot develop confidence in their own perspective unless an adult validates their emotions. Maybe aunt or uncle so-and-so was being inappropriate with them. If you brush it aside, you'll never hear more about the story. Children generally don't want to tell when they've been molested. They keep the secret for years. So they're going to test the waters and see how you respond. Are you defensive? Are you quick to talk over them and put words in their mouth? Or are you willing to meet them right where they are? So those are, that is just another example of my Disneyland example, how we really need to meet them where they are and to validate their experience. We don't want a careless response to make them feel like they're not valuable. So making time to show how you love spending time with your child and really communicating with them on their level is something that will demonstrate that you place them in a high position of value. Okay, number 4 is communicate simply one task at a time, or 2 if they're ready. Concentrating is difficult for kids with trauma. Try not to overwhelm them because they are likely having a hard time remembering even one simple task. If your child does well with a chart, you may consider identifying simple tasks for even a daily schedule. But be sure to only do charts if you can stick to it. Otherwise, just one simple instruction at a time will work. And number 5, as their parent or guardian, let the child know that you understand their behavior is normal after all that they've experienced. It's up to adults to help the child not feel shame for their reactions and challenges. Even children who are difficult, aggressive, obstinate, it's important that we can have a meaningful conversation, not in the heat of conflict, but to have a meaningful conversation, showing that you are trying to understand, you want to understand them, you do have significant compassion for them, and that you're on their side to help them work through that. Living with complex PTSD is really hard. And it's hard for adults too, depending on where you are in the healing process. As an adult, it can be overwhelming. But as an adult, having complex post-traumatic stress is not an excuse to hurt those around you, especially your child in the developmental stages of life, where their brain can be significantly impacted by the ways you interface with them. So it's important that you hold yourself accountable for your actions and know when to take a meaningful time out to regulate yourself if you become dysregulated. As the adult, you might be the one who has experienced child abuse or trauma, or maybe you've experienced trauma in your adult family life that has also traumatized your child. Controlling your kids in ways to either mitigate the fear something might happen to them or controlling them to avoid being triggered yourself can be just as harmful as lashing out at them. Kids need to form a sense of personal identity and learn to manage their own emotions and lives. If you're too overbearing or if you're too reactive, they won't have a chance to develop a much needed sense of autonomy and mastery of skills, confidence, belief in themselves, trusting and valuing their own personhood. Many professionals, I hate to say this, but I just want to convey this because I want you to know how serious this is for those of you who are struggling with CPTSD. Many professionals don't believe that a parent with unresolved trauma can place the traumatized child in the prioritized position, serving the child's trauma first. The parent is emotionally fractured. And let's face it, even if you don't have a history of trauma, children can be very triggering at times when they act out and so forth. Remembering that trauma, whether one is an adult or a child, results in involuntary reactions in you and in them can help you. the child's developmental needs must come first. And so if you think about it for a second, you know that your child can be triggering to you, but you can also be very triggering to your child. So let's dig just a little bit deeper on that point. How do we parent while living with complex PTSD? All parents make mistakes, and healthy parents will hopefully regret their prior errors. But when your actions become emotionally or physically abusive, or when you shut your child's voice down, you're exacerbating your child's trauma. The following tips may help you if you're concerned that your complex PTSD is affecting your parenting. Number one, take a time out in order to review if your reaction or response was really the best fit for the situation. So if your child spilled something in the living room and you're freaking out and screaming, chances are you were triggered and the traumatized part of your brain is involuntarily reacting. While this type of response is normal to trauma, it doesn't mean that it's not harmful to your child. So tell your child, you need a few minutes to think about what just happened. Allow your traumatized brain to regulate so that you can process what happened and come back to your child in a way that responds more appropriately. Coming back to quickly correct a harmful interaction will help your own child learn the coping skills that they will need when they're traumatized. And as well as then they won't internalize the event with shame towards themselves. Number two, communication is key. Be willing to apologize. A sincere apology can go a long way. Doing so also demonstrates to the child, and I want you to hear this, that humility is not the same as shame or humiliation. Remember, traumatized children are experiencing a lot of shame, so they may have a really hard time apologizing because it feels too humiliating and more shame-driven for them. So it's important to role model good apologies. And it's important to understand that even though a true apology is really valuable, it needs to be supported by meaningful change. You as an adult need to hold yourself accountable to changing your traumatic outbursts. And there's a lot of work that goes into that. Talk to your child and let them know that adults are not perfect. It's okay to help them understand what it feels like for you to live with complex post-traumatic stress and how it can sometimes affect the way that you react or respond to them. This will help them learn your reactions are not about them and not their fault. Okay, number three, if you feel and observe that you cannot stop overreacting or let go of controlling behaviors over your child, it's really time to seek qualified professional help. A trauma-informed professional can help you understand how your own trauma is affecting your brain, as well as how it is affecting your parenting. A trauma-informed professional can also help you learn how to manage your complex PTSD to prevent continuing the cycle of trauma in your family. And you really need help with that. Complex PTSD oftentimes takes years to heal and multiple modalities. Just therapy only is not enough. You need to do a number of things, and learning how to cope with, I'm going to touch back on that point in just a second, but learning to cope with your trauma can be life-changing, not just for your children, but for you as well. And you can go to an earlier intensive that we did on PTSD and complex PTSD and learn some other ways that you can help your body heal, your mind and body heal. Okay, number four, don't be too hard on yourself. As a person with CPTSD, especially if you're a child traumahood survivor or a domestic violence survivor, you may be hypersensitive to never want your kids to feel bad again. You may just be working overtime to want to shower them with affection and positive experiences. It may feel good to know that they won't ever feel sad like they did in the recent past, but protecting kids against any future sadness is not realistic. They need to learn skills and develop resilience to cope with issues in their own life. It's okay to not be the perfect parent. In fact, it's important for your child's development by how they see you respond to your own mistakes. That's what children need to learn those coping skills themselves. And what children need is for you to quickly regroup after a mistake so they can feel secure in knowing that you are a safe place to come to when they need your support, love, and encouragement. Okay, number 5, learning tools to succeed at parenting. Most of us have been parented by adults who made many mistakes. It's not uncommon to cycle through to the next generation what you yourself experienced through your own parents. There are countless educational courses in local communities that focus on parenting skills. Take a few parenting classes. Don't feel shame or don't feel that you're so knowledgeable that you don't need them. Psychology has come a long way in understanding what children need most, as well as how to parent challenging children. Taking a few classes is likely to give you the insight you never had, as well as the skills that maybe open your eyes in ways that you never imagined. For example, I'm just going to give a simple example. If you were parented in a style that was largely punitive in nature, it can be difficult to think up new ways to parent through positive reinforcement while still holding boundaries. A good parenting class will have lots of ideas to help you develop a new path to parenting your child. And parenting while living with complex PTSD can be really hard and manifest in ways where your child feels confused, shamed, unstable, and even unloved. So when you adopt an attitude willing to hold yourself accountable, willing to learn, and pursue the help that you need from experts, you can become the parent that your child and your children deserve. And they will see your growth, and they will see that you put effort into growing. And that will be a modeling for them that they really need to incorporate into their own life as they embark on therapy or activities to improve themselves. So that's basically what I wanted to share with you today. There's so much more I could talk about on this subject, but I think if you Google developmental trauma disorder, you'll find a number of wonderful articles, and Google attachment styles. I think that will help enhance what we talked about today. So in closing, I'd like to invite you to join our mailing list where you receive our blogs, newsletter, and updates about our training courses. Please head over to our website and sign up today to continue along this journey. We would love to have you join us. And now we'd like to take a few minutes for any questions that you may have. So please feel free to drop them in the chat box at this time. Thank you. Jill, do we have any questions?
We do. We have quite a few. So I'm going to go ahead and get through them and then I want to make 2 quick notes. One, for anyone who had come in late or is hoping to be able to get notes to this talk, this is a recorded intensive. And just by being here, you actually will receive the recording. So you will have that via email. And then you can also find this on our YouTube if you need to go back and write some things down. A lot of good info was shared here today. And then also, if we go over the 11 o'clock hour, feel free to hop off, but we always like to stay on and try to address all your questions. So we will do the best we can. Okay, so here's the first question, Annette. Do you have suggestions for a mother who is dealing with their children who have been traumatized by domestic violence towards their mother by their father? Divorce has occurred, but the father still has visitation rights with the kids and continues to tell the children ugly things about the mother.
This is so common, and I'm so glad this question came up because I wanted to touch on that. I think it's depending on how it's affecting the kids, it may be time to go through where there's a counselor involved and where you go back to court and address some of these issues. But a lot of times there's not a lot that you can do in terms of the legal, in terms of legally confronting or addressing or holding the other parent accountable. What I encourage you to do, depending on the age of your child, is to really take time speaking to your child about healthy emotions or all emotions. And there's so many wonderful charts available on the internet that are age appropriate. So like for a very young child, it would just show a happy face, a sad face, maybe a scared face, you know, like, but it goes all the way up to adult age where there's so many emotions that are explained, and doing so increases your child's emotional IQ. And when you do that, you can also, depending on their age, and I've taught kids in 6th grade about what I'm about to talk to you about. If you go to our website, to our resources page, you'll see our list of terms and definitions regarding covert emotional abuse. And so there's all these terms like blame shifting, minimization, so many different terms, and you can start to educate your child about those different manipulative behaviors and ploys that somebody abusive would use. And because abuse, while physical is part of it, and not always, but it can be a part of it, it sounds like in this situation, but emotional abuse, covert emotional abuse, is the common thread in all abuse cases. So by teaching children that language so that they can actually put words to describe these covert behaviors, you're empowering them. Now, not every child is going to be willing to even hear that their parent is abusive. So for some of you, the abusers have won over favor with the child, and they've managed to paint you in a really bad light. And in those cases, I just recommend that you don't talk about personal problems with them, but rather that you spend whatever time you have with your child. And maybe the abusive parent was able to obtain custody, or the children chose to go live with that person. If you use your time to just really focus on what's going on in the child's life, you know, tell me about school, tell me about just really invest in them, and don't bring your drama, your problems into the equation. Don't respond in like kind to the other parent's slanderous comments. You know, rise above that and show the child consistently over time that your main focus is your child's health and well-being. That will win them over in time. It's the best way to accomplish that in my view. Okay, Jill, next question.
Yes. So in the context of the proposed diagnosis of developmental trauma disorder, is there a definition of what domestic violence means?
I don't believe that it is. I don't recall reading that in the developmental trauma papers that I read. But domestic violence can be psychological abuse, verbal abuse, mental abuse, physical abuse. One or all of those things can constitute domestic violence. I think that's a good question, because I think a lot of people think that if there's not physical violence, that it's not domestic violence, but that's just not true. More and more therapists and more professional organizations are recognizing that psychological abuse is more damaging than basically all forms of domestic violence, except for life-threatening battery, because it really is the key part that confuses victims and that keeps them wondering what's happening to them in the relationship, where they're unable to identify that it's actually domestic violence. I hope that makes sense.
Yes, thank you, Annette. So this This question, we have so many great questions. So I'm just gonna, okay, I'm plugging away. When a traumatized child becomes violent, what is the best way to restrain or calm them? I see a lot of children diagnosed with ADD. Is this the appropriate diagnosis when the main cause for these behaviors could be from trauma? And how do you go about getting the correct diagnosis?
That is such a good question. I think a lot of kids with ADHD are misdiagnosed. That really the core, the origin is really trauma motivated or trauma, a result of trauma. And I mean, I have had the hardest time finding really good child psychologists that are specialists in trauma. It's not easy, but you can by possibly contacting trauma facilities at universities. There's a number of, I mentioned Connecticut I mentioned what in the talk. I would have to scroll back to read it, but there's Harvard has a trauma institute, Pepperdine has a trauma institute. I think I would probably reach out to those university faculty members and ask for who is on staff that is an expert in that area, and if they have any recommendations or if they're conducting any therapy. I would probably go that route, or even looking at authors of books about trauma and reaching out to them. You want somebody that is really an expert to be able to service you in this area. Does that answer the question?
I think so. And it's a little bit difficult to tell if this person is a professional, possibly.
Can you read me the question one more time?
Sure. So when a traumatized child becomes violent, what is the best way to restrain or calm? There's multiple questions. What is the best way to restrain or calm them? I see a lot of children diagnosed with ADD. Is this the appropriate diagnosis when the main cause for these behaviors could be from trauma? And how do you go about getting the correct diagnosis?
Well, when a child becomes violent, I think it's really important that you remain very calm, which is so hard to do. And every child is different. Some kids may respond to like rubbing their back. A younger child who's really having a temper tantrum, that's having a hard time, you might need to sit behind them and then hold on to them tight, especially if they're thrashing around and they're trying to hurt themselves or hurt other people. You just hold them tight and speak kindly into their ear and just let them feel your, security. If it's a child that's older and has more capability of understanding what they're doing, you don't want to shame them, but it's perfectly appropriate to set firm boundaries and say, when you are violent towards me or when you are destroying things, I'm going to take away something that you value for a certain amount of time. Like that might not be the appropriate consequence, but you need to design consequences specific to your child. I just don't want you to be punitive in that. You can say, I love you, I care about you, and I want to help you overcome this. So we're going to have these rules in place to help you think about your actions and to develop better coping skills. And then get them the help and support that they need so that they can learn new coping skills. Maybe get them a punching bag that they can take their aggression out. I'm just thinking that up off the top of my head, but I think each child needs to be treated differently. Okay, Jill, next.
Yes, next question. This is a longer question, so let me know if you want me to pause or repeat anything along the way. How do I take responsibility for my harm to my son, who is 14 and on probation for assaulting me, attempted strangulation, in front of my girls for not allowing him to have his cell phone in his room at night, when we were all experiencing coercive control from my husband and my husband's repeated degrading insults, accusations, isolation, rage, breaking things toward me, and at times my children. My husband is an attorney and we are in the process of divorce, so I have to be very careful. My son is with my husband and my girls are with me in another state. He wants primary custody of all the children and got it in his first marriage and divorce. So the original question is, how do I take responsibility for my harm to my son who's 14 and on probation?
Oh gosh, I think that is so hard, and I'm so sorry. You're really in a challenging situation. I think I just would seek professional help. I'm not a clinician, so I might not have the best information for you, but I think I would also just really try to develop a really good line of communication with your son where you show your compassion, where you show that, you don't shame him for what has happened, that you're genuinely very concerned, because, behaving like that can put him in jail if he was older, or if he acted out that way with another person. He could find himself in juvenile hall or a number of consequences that would be a lot worse than probation. So you don't want to minimize that, but I would just try to be really validating of their feelings, and validating of their personhood, pointing out the good qualities that they have, and then just recognizing that they need better coping skills for when they're upset, and that having just a good conversation, that adults get to choose the rules, and when they'll appreciate those rules when they're older and they're able to look back. And in the meantime, things might not feel fair, but they're put in place for a really good reason. And trying to just talk to your child reasonably, I think may help that, treating them as a valued individual and not punitively speaking down to them. And I don't know what your role was in the prior domestic violence, but maybe for staying too long, or maybe for being complacent when there was aggression going on in the house, not, like maybe you were appeasing the abuser and you didn't put your foot down, who knows? But I think that as long as it's not too much drama in the conversation, it's good to apologize for things that you tangibly know, especially if your child expresses their disappointment about some way that you handled something. I think it's important that you make amends and show ways that you've learned different coping mechanisms and so forth. I'm not really sure what the specifics are, so I'm just taking a swing at it. Your question.
Yeah,
Cool.
it's really, these situations are so complicated. And then her expressing also that her husband is an attorney and she has to be really careful even what she said.
That's so hard.
Yeah, it's really challenging, but you said the right thing, and professional support is something that you deserve to have and need to have along this journey. So
I think until I got through the legal case, and that where you have secure the custody of the two children that are in your custody, I would be really careful what I communicated to your son. But you can really be present for your son, even if it's, over the phone. You can be really interested in their life. You can show how much you love and care for them by really engaging them where they are, what music they're listening to, what activities they're involved in, and really, participating over the phone, showing your interest. I think that could be something to help get you by for now if you are really cautious about what you communicate.
absolutely. It looks like we have 3 more questions here, so we will address them. It is 11 o'clock, but we will stay on and address these. Would you recommend EMDR or a certain treatment for a child with CPTSD with active triggers?
I do recommend EMDR with somebody who is qualified. So maybe somebody who's actually a trainer of EMDR to other therapists, somebody like that, and somebody who's also skilled in child psychology. And these are hard people to find, but it's worth the effort to make sure that you align up with somebody that's good. I mean, the reports show that EMDR is really helpful. Now, I've heard a couple of stories where EMDR caused a setback. I think it's important for you to do a little bit of research, whether you're going to deal with immediate triggers or past traumas. I haven't done a lot of research on that. I've read a few papers about how there's a recommendation to not do one and do the other to start out with, or it can be too overwhelming. And I just can't put my finger on what it was that I read about that. So I would recommend that you take some time and do some of your own research. I hope that helps.
Okay, and then the next question is, do you know if there are any inpatient treatment centers for mothers and children where they can heal together?
Oh gosh, that would be wonderful, wouldn't it? I have not heard of any. I haven't. If you had a real trustworthy person that you could leave your child with while you went inpatient, I think it's really, it's like being on an airplane and you put your oxygen mask on first. I think that would really help you serve your child better if you could could take a jump forward on your healing. But I'm sorry, I don't know about a place that, if you find one, please report it back to us.
Yeah, that's a wonderful idea.
Mhm.
And then I have one last one here that you had mentioned to search on Google. There were two things. There's one on developmental styles and one on attachment styles.
Now, one is on developmental trauma disorder that we talked about today. There's so much more information about it in the articles from Bessel that I think you would learn more from that, and it'll help crystallize your thoughts by having something in writing. And then the other one was attachment styles.
Okay, great. So I think I've addressed all of the questions. If I
Okay.
did miss any, please email us at info@themendproject.com. We don't want to miss any question or comment, and always feel free to lean on us. Our team is here. And Annette, I think that concludes our time.
All right. Thank you, everyone, for joining us. Spread the word about our intensives and our YouTube channel and what we provide on our website. We would really love your partnership in that way. Thank you and have a wonderful week. Bye-bye.